The mental health of our children is a natural and important concern for us all, especially to the parents and teachers.
And yet, many mental disorders have their beginning in childhood or adolescence that may go undiagnosed or untreated for years. Hi, this is Gemma Judel A. Evangelio.
I'm April Jin, and you are watching WSCWC. There are 13 categories of disability served by IDEA. That is autism, deafblindness, deafness, emotional disturbance, hearing impairments, intellectual disability, multiple disability, orthopedic impairments, other health impairments, specific learning disability, speech or language impairment, traumatic brain injury, and visual impairments including blindness. For this discussion, we're going to talk about the fourth category, which is emotional disturbance. In this discussion, we're going to talk about what is emotional disturbance, its characteristics, causes, and symptoms, also the educational challenges that a student may face if he or she is diagnosed with emotional disturbance. Another is parents or family's involvement, and intervention and treatment. So without further ado, let's get started to talk about what is emotional disturbance. Now, let us take a look what emotional disturbance really is. When we say emotional disturbance, it means a condition of exhibiting one or more of the following characteristics over a long period of time to a marked degree that adversely affects a child's educational performance. Now, these characteristics include A. Inability to learn that cannot be explained by intellectual, sensory, or health factors. B. Inability to build or maintain satisfactory interpersonal relationship with peers and teachers. C. Inappropriate types of behavior or feelings under normal circumstances. D. A general pervasive mood of unhappiness or depression. And E. A tendency to develop physical symptoms or fears associated with personal or school problem. In addition, children with serious emotional disturbance may exhibit distorted thinking, excessive anxiety, bizarre motor acts, and abnormal mood swings. Their behavior signals that they are not coping with their environment or peers, such as their friends, their classmates, and even their teachers. Take note that if a student has one or more characteristics that I've mentioned earlier, that doesn't directly mean that that student is diagnosed with emotional disturbance. However, if that student continues to have that characteristic for a long period of time to the point that it negatively affects his or her studies, then that is the time we can call it emotional disturbance. Now, let's talk about what causes emotional disturbance. No one knows the actual cause or causes of emotional disturbance, although there are several factors such as heredity, brain disorder, diet, stress, and family functioning. The factors that I've mentioned have been suggested and vigorously researched. A great deal of research goes on every day, but to date, researchers have not found that any of these factors are the direct cause of behavioral or emotional problems. Emotional disturbances can affect an individual in areas beyond the emotional. Depending on the specific mental disorder involved, a person's physical, social, cognitive skills may also be affected. Now, here are symptoms or signs seen in children who have an emotional disturbance. First is hyperactivity, or short attention span, and impulsiveness. They are usually classified as an inability to focus or sit still for a long period of time. Another is aggression or self-injurious behavior. These come in the form of hitting, pushing, yelling, throwing objects, or trying to injure pets or people. They are acting out and always looking for a fight. Next is withdrawal. These include displays of anxiety or fear of other people or situations that may occur. These people are not interacting socially with others, and excessive fear or anxiety is seen. Next is immaturity. This is seen when a child shows emotion at an inappropriate time, such as laughing at a sad moment. These children may exhibit inappropriate crying, temper tantrums, and have poor coping skills. And lastly, learning difficulties. These children are academically performing below grade level and peers. Mental disorders have different umbrella terms, such as emotional disturbance, also known as behavioral and emotional disorder. Another is behavioral disorder and mental illness. Beneath these umbrella terms, there is actually a wide range of specific conditions that differ from one another in their characteristics and treatment. These include, but are not limited to, anxiety disorders, bipolar disorder, sometimes called manic depression, conduct disorders, eating disorders, obsessive compulsive disorder or OCD, and psychotic disorders. Now don't you worry because we will talk about these disorders one by one. First is anxiety disorder. We all experience anxiety from time to time, but there are people out there that have excessive, persistent, seemingly uncontrollable, and overwhelming anxiety. Irrational fear of everyday situations may be involved. This high level of anxiety is a definite warning sign that a person may have an anxiety disorder. In actuality, anxiety disorder is a broad term covering several different disabilities that share the same core symptoms of irrational fear. These include panic disorder, obsessive compulsive disorder or OCD, post-traumatic stress disorder or PTSD, social anxiety disorder or social phobia, and other specific phobias. According to the Anxiety Disorders Association of America, anxiety disorders are the most common psychiatric illnesses affecting children and adults. Next is bipolar disorder. This is also known as manic depressive illness. It is a serious medical condition that causes dramatic mood swings from overly high and or irritable to sad and hopeless, and then back again, often with periods of normal mood in between. Severe changes in energy and behavior go along with these changes in mood. Next is conduct disorder. Refers to a group of behavioral and emotional problems in youngsters. Children and adolescents with this disorder have a great difficulty of following rules and behaving in a socially acceptable way. This may include some of the following behaviors: aggression to people and animals, destruction of property, deceitfulness, lying or stealing, or truancy or other serious violations of rules.
Now we are down to the next disorder. The next is the eating disorder. Eating disorder is characterized by extremes in eating behavior. Either it's too much or too little. It is also characterized by the feelings of extreme distress or concern about body shape or weight. For eating disorder, there are three distinguished types. Here are the anorexia nervosa, bulimia nervosa, and binge eating. Anorexia nervosa, it is the self-starvation and dramatic loss of weight. While bulimia nervosa, it is involving a cycle of binge eating, then self-induced vomiting or purging afterwards. While for the last distinguished type, it is the binge eating. Binge eating is also considered as an eating disorder, which it is characterized by eating excessive amount of food while feeling unable to control how much or what is eaten. Unlike bulimia nervosa, People who do binge eat usually do not purge after eating by vomiting or using laxatives. The next common disorder under the emotional disturbance umbrella is the obsessive compulsive disorder, or commonly known as OCD. OCD is also considered as anxiety disorder, which is characterized by recurrent unwanted thoughts or the obsession and repetitive behaviors or compulsion. People with OCD perform hand washing, counting, checking, and cleaning as often as they could, as they consider it as a ritual in which they hope that it will prevent them from having obsessive thoughts and making them go away, which these repetitive behaviors only give them temporary relief, and when it is not done, their anxiety goes higher. Let's go with psychotic disorder. Psychotic disorder is a general term used to refer severe mental disorders that cause abnormal thinking and perception. The two main symptoms are the delusions and hallucinations. Delusions are false beliefs, such as thinking that someone is plotting against you, while hallucinations are false perceptions, such as hearing, seeing, or feeling something that is not there. While schizophrenia, it is a severe mental health condition that can cause confused speech, delusions, and social withdrawal. After knowing the characteristics of those disorders mentioned under the emotional disturbance umbrella, we could already see what are those educational challenges that those emotionally disturbed persons may face. Some students with emotional disturbance or behavioral problems have negative self-concept and low self-esteem. In the classroom, students may be frequently off task and may adversely affect the learning of some students. Students may have problem working in groups and in forming relationships. Students may show aggression towards others or refuse to cooperate. So in general, with those inattentiveness, obsessions, hallucinations, delusions, we could really see that they will encounter learning difficulties. Individuals who are emotionally disturbed are not the only ones who solely carry the load, but as well as their family and parents, as well as those people surrounding them. Prior research has shown that students with emotional and behavioral disorders respond to intensive efforts that incorporate individualized behavioral interventions involving their parents as partners, and that use of data to guide treatment and decisions. Parents have the most information regarding the history of their child and are the most knowledgeable about their child's history and home environment. Therefore, it is essential for parents to be actively involved in planning and implementing behavioral interventions to maximize effectiveness. It is also noted that parents as partners of teachers towards the learning of those emotionally disturbed individuals, parents as partners of the community, parents as partner of the psychiatrist or any therapist. As what Dr. Pratt asserts, the whole family should always be treated along with the child. Emotional disorders are typically treated with a combination of medication and psychosocial interventions such as cognitive therapy and behavioral therapy plus the interpersonal therapy. The most widely used therapy for children are the cognitive therapy and the behavioral therapy, but oftentimes these two approaches are merged into cognitive behavioral therapy. But separately, Cognitive therapy seeks to free patients from the negative thought patterns that often weigh them down when they're feeling low. Just like the tendency to overgeneralize, saying, I can't do anything right, or the tendency to view each unhappy experience as further proof of a preordained conspiracy to hate their life, saying, nothing good ever happens to me. Cognitive therapy is not as simple as telling youngsters to think positive. In fact, studies shows that the power of positive thinking is rather a feeble weapon against depression. Cognitive therapy teaches patients not to dwell in negativity and to exercise mind control over how they perceive situations, while behavioral therapy targeted to unlearn self-defeating attitudes and behaviors. With young children, behavior modification often incorporates a reward system, like gold star in schools or prize. With teenagers and adults, desirable behaviors are reinforced through general improvement in their mental outlook. Along the treatment and intervention, the CBT or the cognitive behavioral therapy encompasses individual therapy, family therapy, and group therapy. The individual therapy is usually complemented by family counseling and group therapy. The child in therapy obviously is unable to handle what is going on in his or her environments, and the environment includes home and school. In family therapy, the counselor guides the members in airing their feelings and helps them work toward resolving household conflicts. Group therapy, attended by 5 to 10 children and led by a trained counselor, provides opportunities to learn with and from one another. Youngsters realize that they are not alone. What's more, sometimes examining other people's behavioral patterns can shed light on our own problems. The group doubles as a socialization group, helping kids to refine their social skills. CBT may include social training skills because youngsters who are anxious frequently feel awkward in social situations. They are probably not as shy type as they believe themselves to be, but their self-consciousness gets in the way of making eye contact, initiating conversation, and so on. Socialization trainings allows them to practice being more self-assertive, approachable, and communicative. Another intervention for those emotionally disturbed individuals is the interpersonal therapy or IPT. IPT is a short-term treatment for youth with depression and interpersonal problems. IPT helps youth learn to identify emotions and the links between events and feelings, as it focuses on relationships, life transitions, and how to improve the way your youth communicates and relates to others. In general, children and adolescents with emotional disturbance should receive services based on their individual needs. Additionally, everyone involved in their education or care needs to be well informed about the care that they are receiving. It is important to coordinate services between home, school, and the community in order to keep the communication channels open between all the parties involved.
That will be all. Thank you for watching WSC.
WC